Hi, I'm Dr. Rudy Cashman, neurosurgeon in Florida, Indiana, for 40 years, but I'm only 39 years old. I'm going to speak to you tonight about a very interesting subject, the secret of the non-diet for children. Why would a neurosurgeon, myself, at age 39, want to be interested in that? I tell you the reason is that I'm treating the products, the diseases, the illnesses, the strokes, the heart attacks, the diabetes, the Alzheimer's disease that are the product of eating the wrong foods starting as a child. The best way to prevent those diseases is to teach the child a proper way of eating. And that's what tonight's lecture is all about. And this is going to be a little bit of fun, and I think quite interesting. Let's start. Let's look at the state of the children's health. What is the situation in this country today? 60% of adults are overweight. A very serious problem, because it is these same adults, us, that are teaching our children how to eat. They watch us eat. They copy what we do. So this is extremely important for the children, but also for the adults. We in the U.S. lead the world in strokes, heart disease, diabetes, and dementia. We lead the world because we're eating the wrong food. 32% of children are overweight today. Many of them don't realize it. A lot of times the mothers and fathers look at the children, they think they're of normal weight and it's no problem. When many times they are wrong. It is the most common pediatric disease. It's not influenza, it's not the flu, it's not heart disease, strep throat. Obesity is the most common pediatric disease. From age 2 to 5, the obesity rate has increased from 5% to 13.9% in the last 10 years. Overall, there's been a 300% increase in overweight and obesity in the United States in the last 10 years. And we're thinking it probably will double again in the next 10 years because our diet is progressively becoming worse. What's the definition of overweight and obesity? When should you consider that you're overweight and you're obese? The general measurements we use today is body mass index, based on your height and your weight in pounds or in kilograms. And they have graphs that show you where you are on the graph. Like an adult, 25 and over, you're overweight. And a child, most of the time, it's based on percentages. And we'll discuss that in more detail. Like an adult BMI, 25 to 30, body mass index, and you're overweight. 30 to 35, you're obese. 40 and over, you're morbidly obese. How do you evaluate children? The body mass index is very important. If you go to a doctor, he certainly should have a body mass index chart of your child starting around age 2. And just should keep track of this. And every time you come to the office, the nurse should measure you and you should discuss the BMI with the doctor. If he doesn't bring it up, you may be having a problem and don't realize it. Waist measurement is another one. It's used in many countries, but in the United States, we really do not have any good graphs you could refer to. I think a general rule would be that your measurement at the umbilical level, at the umbilicus level, should be smaller than the nipple level or the hip level. If it's bigger than that, you probably have an obese child. They have some graphs in Brazil, but they eat totally differently, so we can't really compare the two. And sometimes I ask the pediatrician, how do you tell if a child is overweight at Lutheran Hospital? I asked them, and one said, well, I just look at them. Well, that's just not going to do it. That's not going to do it. Another one said, well, I try to find out what kind of shape they're in, so I have them do some push-ups. That's just not going to do it. We need to use the waist measurement, BMI measurements, and record them in the office record. When you're evaluating your child, if they're in the 85th percentile, they're overweight. Again, based on a graph. I wrote a book called The Secret of the Non-Diet. In other words, not dieting, food selection. In the back of that book, there are graphs for boys and girls for body mass index. They are different for children than for adults. You must remember that. If they're in the 90th percentile, in other words, 90% of the children weigh less than you, and you're above the 90th percentile, then your child is obese. An overweight child at age 8 with a BMI, elevated BMI at age 8 of 41, as an adult will have a BMI of 41. Very interesting. So obese children lead to obese adults. What are the effects of childhood obesity? Obvious psychiatric and cosmetic problems arise. Kids make fun of them. And at least some people, you may just love your child, and the child may be obese, and you think the child looks just wonderful. But that may not be the way the rest of the world is looking at them. For example, employees today are less likely to hire someone that's overweight if they have a choice. I mean, if they smoke, they may not want to hire them. If they're obese, they may not want to hire them. So you have to consider the employability and the future of your child. You have to, again, the effects of childhood obesity. Long-term effects is diabetes. Many children today have diabetes. Would you believe it? We have a lot of kids, not with type 1 diabetes where where your pancreas isn't working, where you need insulin. I'm talking about the type 2, which is a result of insulin resistance from obesity. Type 2 is starting to become common in children. And of course, if you're diabetic as a child, you're surely going to be a diabetic as an adult if you don't do something about it. So the long-term effects of diabetes, vascular disease, strokes, heart attacks at a young age. Many people have a heart attack at age 30 or 45, and believe me, it happens. They many times are obese as teenagers. Heart disease begins at age 4. Yes, they've proven that in autopsies. So to obtain a cholesterol level in a teenager is a very reasonable thing to do. They don't generally do it unless you have familial cholesterol problems. I personally think we should obtain a cholesterol level on all teenagers. Everybody's got to know their figures. Adults need to know what their triglycerides and HDL, the good cholesterol, and LDL, the lousy cholesterol and triglycerides are. Every adult should have a card in their wallet, but you should do the same courtesy to your children, because the heart attacks and strokes that I see at a young age started as a teenager, and that's why I'm here today trying to prevent that. Patients who are obese as a child have much more cancer, even children's cancer, much more common adult cancer. 20% of breast cancer, prostate cancer is due to obesity. It's due to obesity because fat has in it 20 nasty chemicals. Chemicals that cause inflammation. That inflammation causes cancer, vascular disease, Alzheimer's disease. Patients who are overweight and obese will affect their neurons in their brain. They're not as intelligent. Your children would not be as smart. They will not fulfill their potential if they're obese as children. The neurons don't work as good because insulin resistance affects your neurotransmitters in the neurons of your brain. The doubling of the diabetic rate is coming, which will be a huge human and financial cost. So to attack overweight at this stage, the illness of obesity and overweight in children is extremely important. That's the only way we will avoid the doubling of the heart attack rate, stroke rate at a young age in our nation. Of course, a tremendous pain to the people who have it, but a tremendous cost to the government. The effects of childhood obesity. Heart disease begins at age 4. It was proven in the Bogalusa study in Louisiana. They studied children for 40 years in this eastern north district of Louisiana. For 40 years, they studied this group of children. If anyone died, they did an autopsy from an accident or from disease or from cancer. Always did autopsies, and they learned a great deal. When they did autopsies on our Korean soldiers and the Korean soldiers themselves, they found that U.S. Korean soldiers had a lot of vascular disease at age 21. The Koreans themselves, who were vegetarians, had hardly any vascular disease at all. Same in the Vietnam War, the same way. The Vietnamese had very little vascular disease. We Americans were full of vascular disease, proving the point I'm making. 80% of children who were overweight at age 10 or 15 were obese at age 25. 1 million U.S. citizens died last year from heart disease and strokes. And these are 90% diet diseases. Heart attacks and strokes are 90% diet diseases. The China study studied different parts of China where they were eating different diets, and they could correlate the part of China with the diet they were eating. If they were in a big city and they were eating a lot of fatty Chinese food, we started to pick up cancer and heart disease and strokes. Then you had some of the rural cities where they ate a vegetarian diet, and they found very little strokes, very little heart disease, hardly any cancer whatsoever. No breast cancer whatsoever, hardly any prostate cancer. So it depends on what we're eating. There'll be 1.5 million deaths from vascular disease in this country probably 10 years from now if we don't change before that time. In 1973, Dr. Gerald Berenson studied 15,000 children in Bogalusa, Louisiana. It's on the internet. You can put the name in there and you can read the whole study. It's very interesting. That's where this data came in about vascular disease in children and diabetes in children. They did autopsies, and all that died accidentally or from a disease. So they learned a great deal. They found the lousy cholesterol, the LDL, was elevated as early as 6 months of age. Isn't that interesting? Dr. Charles Atwood studied this study a great deal, and he was also from the Louisiana area. He checked the blood sugar and fat of all teenagers. So at this time, the American Pediatric Association say check the cholesterol and fats, triglycerides, LDL, HDL of teenagers if there's a history of vascular disease in the family, like dad died at age 45 or grandpa died at a young age. But I don't agree with that. Neither does Dr. Charles Atwood. I have his book right here, Dr. Charles Atwood, a very good book to read. I've read it. And he clearly states you should check the fats and blood sugar, HDL, LDL, triglycerides, even in teenagers. And I don't care if they're skinny. I've got some relatives that eat meat all the time, and they're skinny. I'd love to know what their cholesterol shows. I will bet you it's elevated, unfortunately. They found aortic fatty streaks at age 3. At age 3, from children who were fed French fries and things of that nature at a very young age. Syndrome X, you hear a lot about today. Why is it called Syndrome X? Because it's kind of a mystery. They don't quite know totally yet what it means. It's also called metabolic syndrome. In Japan now, they used to eat vegetarian diet, and they were all skinny and lived a long life, but now they're eating American food over there, and obesity is a real problem in Japan now. So they don't like the word obesity. So they found a lot of the children have metabolic syndrome, which I'll tell you in a minute what it is. They call them metabos. Metabos, a lot more friendly term. Metabolic syndrome is insulin resistance, where insulin no longer works. The triglycerides in your blood enter the fat cells swells, and the receptor sites for insulin on the outside of the cell no longer work. Will not let sugar into your cell. That's insulin resistance. And insulin resistance is a very important thing. Insulin resistance, glucose intolerance syndrome, pre-diabetic syndrome, metabol, Dr. Raven syndrome. That's other terms for metabolic syndrome. Metabolic syndrome itself is hypertension, insulin resistance, high LDL, low HDL, large waist measurement, and hypertension. If you get 3 of those, you got metabolic syndrome. In this nation, we have 47 million people who have metabolic syndrome. 47 million people, and half of those don't even know it. They don't even know it. They're the diabetics of the future. They're the cancer patients of the future. They're the Alzheimer's patients of the future. So you need to know your BMI, and you need to know your figures, and your figures need to be in your wallet, and you got to have them in your brain. I carry mine always right here in my pocket. Why? because I'm going to lecture to people about eating proper foods. I like to prove it to them that my figures look pretty good. My triglycerides are 26. My dad owned a deli. I love to eat, but I don't eat that food anymore. If you want the right figures, you got to eat the right food. So what is metabolic syndrome is the body's inability to properly metabolize food that we eat. It can't break it down properly. Syndrome makes the diagnosis, as I already mentioned: insulin resistance, glucose intolerance, obesity, high triglycerides, the fat in your blood, hypertension, waistline greater than 40 inches, HDL less than 40. These are if you get 3 of those, you got metabolic syndrome. Remember, a lot of people don't have it. You might take a look at yourself and see if you got it. Probably 40 to 50 million people in the U.S. have it. Healthcare providers, as physicians, must be wellness teachers. Actually, what does the word physician mean? I asked a bunch of doctors the other day. They didn't know what it meant. You know what it means? Teacher. It means teacher. Doctors got to be teachers, not prescription guys, not scalpel guys. They got to be teachers. Number one, they need to be a teacher. The other stuff comes behind that. Know your BMI. Does your child have a pot belly? Take an honest look. Take an honest look. Syndrome X, let's continue in that. You can also use a waist measurement. Is your child a couch potato? That's another one to consider. Is your family eating a lot of chips, donuts, drinking soft drinks? Remember, soft drinks, high sugar. I was giving a little lecture while I was operating the other day, and a doctor wanted to lose a little bit of weight, and I saw him in the doctor's lounge, and he said, I'm following your diet, Rudy, and he shows me this drink he's having. I said, did you read the label? No, he didn't read the label. You got to read labels. 39 grams of sugar in that tea he's having. I mean, not the right thing. You don't lose weight like that. And so is your family eating a lot of refined carbohydrates? That's carbohydrates with the phytochemicals stripped off, like a baked potato without its skin. Removing the wheat, for example, take the kernel off, and you miss all that healthy stuff. Now you're eating white rice. What's white rice? Or white bread? Sugar. You might as well eat sugar. You got to leave the covering on, which has the phytochemicals, those enzymes and coenzymes which have no calories in them and prevent cancer and make you healthy and promote the metabolic system in your body without causing you to gain weight. So refined foods are very dangerous, foods that have been stripped of their natural coverings. So fat is a nasty metabolic factory. I can't stress that enough. Fat is not just something that sits there. It's nasty stuff. It makes adipokines, nasty chemicals, leukotrienes, prostaglandins, things that cause cancer, Alzheimer's disease, strokes, heart disease, and very nasty stuff. So you got to get rid of it if you can. What are iconocytes? You hear this term a little more lately. Not many people know what it means. Eicosanoids, eiko means in Greek means 20. Those are the good fatty acids in your body. And, you tell people, I'm taking omega-3, I'm taking fish oil. And that is really what leads to eicosanoids. They are the intel chips of your body. Before we had oxygen on the earth, and now we have aerobic metabolism. We have to breathe in oxygen to metabolize our sugar. But before that time, we did not have oxygen. It was anaerobic metabolism. We had these eicosanoids. There was no blood system, but the eicosanoids were these 20 carbon chemicals that could jump from cell to cell, and they were the information highway of before aerobic metabolism. But we still have them. Our 70 trillion cells have eicosanoids communicating with each other all the time. They're the intel chips. They're the omega-3. That's the reason we recommend. There are some fatty acids you cannot get out of the food that your body doesn't make it. So you got to take it in with the food. And the good ones are the omega-3s that you hear about. Some omega-6, but we need to eat more omega-3. Triglycerides, HDL ratio, that's the fat in your blood, your triglycerides. In your good cholesterol, HDL ratio is a good measure of longevity. It's got to be less than 2, and you're going to live a long time. That is the best single measurement of longevity. How long you're going to live. See, the reason we develop all these diseases, let's go back in time, to evolutionary time a little bit. 10,000 years ago, we started domesticating animals. We started farming. And what happened was we used to eat the animals that didn't have much fat on them. We used to chase them for 10 miles, catch one and eat them. But now we're putting them in pens and eating them, and we're getting a lot of fat into our body. And the same with farming. Now we have so much wheat, and we strip it of its nutrients, and we eat it on stuff as white bread and as sugar. And our bodies have not had enough time in terms of evolution to change. Our body are not used to this insult of abnormal food. The Pima Indians, for example, in Mexico, are very, very healthy. The same Pima Indians, barely 500 miles away, who are not plant eaters, they eat the American diet, they have a diabetic rate of 50%, high disease of diabetes and vascular disease. Same people, same genes essentially, just eating different food, Very important thing to remember. So what I'm describing here is a way of eating, not a diet, a way of eating. You got to eat differently. I'm not asking to count calories. I'm not asking for portion control. What I'm asking is to eat different food. That's what we'll be talking about. That's the reason this book I wrote, The Secret of the Non-Diet. This is the one for adults that I wrote, came out recently. And I have one coming out in 2 weeks. The one to my right and in your left, that's the cover for that book, The Secret of the Non-Diet for children. For children. Very interesting book, well researched. And so what am I recommending? I'm recommending complex carbohydrates. What's a complex carbohydrate? Baked potato, sweet corn, carrot, broccoli. They all have complex carbs in it. What does complex mean? A simple sugar is one molecule of sugar. But if you combine them into many chains and make it much more difficult to break them down, then they're complex. Like a baked potato is a complex carb with a skin on it. Now you eat a baked potato, you'll at best absorb maybe 60% of it. The rest will not be absorbed because this net of complex carbohydrates would not allow the cholesterol and LDL, the lousy stuff, to all be absorbed. And to break these chains of sugars down takes a lot of energy. So at best, 60% of that baked potato will ever hit your bloodstream. But you eat 100 calories of fat, 97% will sit on your belly or your buttocks in 4 hours. I can put a needle in the belly or the buttock and tell you whether you ate lamb or beef or what you ate. It's been refined that much. You only lose 3% of metabolism. So what type of food you eat, you see, is extremely important. So complex carb, we said, is a baked potato, sweet corn, corn itself. Whole grain foods, foods still with the phytochemicals on them, dark stuff, brown rice, dark bread, pumpernickel. Those are whole grain foods. Be sure when you're reading the labels, they mean whole grain because they can use that to fool you. All types of vegetables are complex carbs. Legumes, beans, all types of beans. So what am I saying? You can eat complex carbs, whole grain, all types of vegetables, all types of beans, and I add that all types of fruits. Of that, if you eat till you're just about full, you're not going to gain weight. You're going to lose weight, and your child's going to look good. But you got to change the way you're cooking at home and the way you're buying foods at home to do that. Fruits, all you can eat. What you want, in essence, is nutrient-dense foods, full of phytochemicals. The redder, the greener, the darker it is, the more you get those 20 phytochemicals that don't have calories in them, which run the enzyme system, the metabolism system of your body. You need those. They prevent cancer. They prevent disease. They prevent inflammation. They're very important. Avoid meats and fatty cheeses and trans fatty acids. Meats are full of cholesterol. They're full of cholesterol. They don't satisfy the appetite. Fatty cheeses, they're full of triglycerides and cholesterol. You're going to get a lot of weight if you eat fatty cheeses. Learn to eat vegetarian cheeses. Very healthy. That's what I do. And trans fatty acids, vegetable oils that have had some hydrogen atoms added to them that make them solid. But now, because they become solid and they make food out of it, that stuff won't even rot. You can let it lay there for 5 years and it's still going to be there. It's not going to rot. And it's very unhappy stuff. Trans fatty acids increase your LDL, decrease your HDL. very dangerous. In some states, they're even outlawed, and they should be. French fries are full of them. Very not a good thing. So let me tell you about the secrets. What's some of the secrets of eating? All carbohydrates are not alike. There's a difference between complex and simple. We said that. Baked potato versus sugar. A lot of difference. No fiber in sugar. A lot of fiber in baked potatoes. Because of fiber, you lose 40% of calories in metabolism of complex carbs. We brought that point across before. I just want to make sure you know it. 90% of the fat you eat is absorbed by the body. Only 30% lost in metabolism. We already mentioned that to you, but I want you to know it. High sugar, simple carbohydrates increase hunger, cause sugar addiction and cravings. You can become an addict to sugar. Let's face it. Let's face it. Food's a drug. It's a drug. It's just like a drug. I know. It's my experience. I drug myself with the darn stuff. But some people drug themselves all day with it. It makes it feel good. Causes secretion of serotonin and dopamine and noradrenaline, and you feel good, and this makes you feel great. But then, boom, sugar goes down because insulin is secreted. Now the blood sugar drops real low, and you get hungry again. You start the cycle over again. Before you know it, you're eating yourself into obesity. Complex carbohydrates promote weight loss and can prevent, stop, or even reverse disease. Dean Ornish, Esselstyn, Joe Furman, famous people, written many good books about proper eating, will tell you how good complex carbs are and how good and nutrient-dense foods are. The more colorful the food, the better and the healthier it is. But Dean Ornish proved that heart disease is stoppable, preventable, and reversible. And I have a patient, Mr. Honeywell in Wabash, in Marion, Indiana, needed a new heart transplant. He wasn't going to have it done. He said, I refused to have it done. So I got him some DVDs and books of Dean Ornish. He read them, and he follows a strict vegan-type diet now, and I'll explain that to you in a little bit here. A vegetarian eats doesn't eat meat. Eats many vegetables. A vegan doesn't eat meat nor dairy, and he's eating mainly a plant diet and fruits and beans and complex carbs. This is what my friend Mr. Honeywell does now. Now 12 years later, he's alive, 76 years old, builds houses. Isn't it something? So Dean Ornish was right. Heart disease is stoppable, preventable, and reversible. Esselstyn, same thing. He took 40 of the worst heart patients and put them on this type diet I'm talking about, and they're still alive today. It's almost not believable. And he's a general surgeon. He took them from the cardiologist, who are not being strict about the diet. And in fact, a cardiologist talks to you, the first thing you should mention, unless you have an acute heart attack, is the diet. First thing they should mention, not the last thing. And so refined fiber and complex carbs absorb fat and cholesterol, defy digestion. Okay? Refined carbohydrates reduce the good HDL cholesterol and increase triglycerides, the blood pressure, and the fat stores. Foods that promote weight loss are high in complex carbohydrates. It takes a lot of energy to break them down. We mentioned that many times now. Complex carbs increase the serotonin level. That's the feel-good hormone in your blood. So they make you feel good. And reduce the appetite, increase the feeling of well-being. The way to do it, when you eat a complex carb, it pushes the amino acids, which are the breakdown products of protein, into your muscles. That raises the tryptophan level in your blood. And that's a very small amino acid that doesn't go into the muscles. It then enters the brain, and that's the precursor to serotonin. You secrete serotonin in your appetite. You feel good, and your appetite goes down. So a complex carb increases serotonin level and reduce the appetite. Reduce saturated fat and simple sugars, very important. Saturated fat increases artery clogging LDL cholesterol. So what are saturated fats? If you eat some fatty beef, there's a saturated fat for you. A monosaturated fat would be olive oil, which generally reasonably healthy, but not a lot of it. I mean, they say the Mediterranean diet is a very healthy diet, but I tell you, I don't think it's healthy as they say. The Mediterraneans get away with it because they exercise a lot. But we Americans don't exercise a lot, and olive oil is 100% oil. So to put a tablespoonful on a baked potato, like I would do instead of butter or cream, is very healthy. But you take 10 tablespoonfuls, you're going to get fat. I mean, that's too much fat in it. Olive oil is high dense fat. All oils are. but there's some oils, better than other. And unsaturated fats in fish oil, walnuts, flax seeds, you get them in a health food store, and plant-based oils reduce your LDL inflammation and plaque within vessels. So to take some fish oil or flaxseed oil, because you got to take some essential fatty acids into your body, but you don't want to be eating a 40% fat diet like most Americans do. You want about 20%, 25% fat diet, and or you're going to obviously become obese or get diabetes and vascular disease. And trans fats are the double whammy. They reduce your HDL and increase your LDL, and that's the stuff that paints your arteries and causes strokes, heart attacks. The first symptom of heart disease in 50% of the people, they're going to get heart disease is what? Ear pain, mouth pain, chest pain, arm pain, back pain? It's death. 50% of the people, their first symptom of heart disease is sudden death. That's why I'm speaking today about the children's diet. Those are the people who ate the bad food as a child and as a young person, never knew it, never had their blood test done, totally unsuspected. They just drop over dead. That happens to half the people with heart disease. That's why the children thing is so important, so important. Olive oil is not a health food. Too much is just not good for you. Here's another interesting one which a lot of people don't know. Human milk is only healthy below H2. No mammal drinks the milk of another mammal. We're the only one drink the milk of another mammal. The best milk is mother's milk. For a child to drink mother's milk to H2, the best gift you can give to your child. And to be drinking milk after that, it's really not very healthy. A lot of fat in milk. Skim milk, 1% milk, I think you'd be okay, but there's no really good reason to give it to the child. There's more calcium in plants than there is in milk. Milk is not well absorbed. Sort of a shock to many people. Breastfeeding for 2 years is the best gift you to your child. Why is that? Because this milk is very fatty, but a child needs it for brain development. A brain is 60% fat. A lot of it's omega-3 fat. Mother's milk has omega-3 fat in it. It also has a lot of the mother's immunoglobulins, the ones that fight off diseases that a child might get. So children who breastfeed get much less ear infections. Dr. Joel Fuhrman also in his books, probably has a children's book, and in it he mentions repeatedly highly nutrient-dense way of eating, which we spoke about. Remember, we spoke about the vegetarian diet. We spoke about the vegan diet, where you don't eat meat or cheese. But you also have what's called flexitarian diet, which I follow. Which I'm 80% vegan or vegetarian. Then Dr. Fuhrman talks about high-dense nutrient-type way of eating, which is really flexitarian. He allows a little bit of meat. But his way of eating is it's high-dense fruit and vegetables and beans and whole grain and complex carbs. He found that the kids that eat that way, very low infection rate, less asthma, less ear infection. It's right in his books. So I think it's a great thing to keep in mind. Animal protein raises your cholesterol. Well, we already discussed that. You eat beef, it's full of cholesterol, and your cholesterol level is going to go up. Plant protein has no cholesterol. And this is interesting. What has more protein in it, 100 calories of broccoli or 100 calories of beef? 100 calories of broccoli has twice the amount of protein in it than 100 calories of beef. Yes, it's been proven. It's out of the books. It's out of the books. You don't need to take protein supplements if you're an athlete. I got it right out of Notre Dame training book. Many famous athletes were vegetarians. Dallas Cowboys are vegetarians. The world's fastest runner, one of my friends tells me, is a vegetarian. So you can get plenty of protein out of plants. The American, the Canadian and American Diet Association have said a balanced vegetarian diet is very healthy even for a 2-year-old. Not under 2, over 2. As long as you feed them a balanced diet. If you're starving them at the same time, it ain't going to work. And you got to be feeding them. So the American and Canadian Dietetic Association plan diet completely healthy for a child after age 2. Very interesting. So secrets of non-diet, let's continue. Balance the vegetables and beans for complete proteins. To lose weight faster, choose raw fruits and vegetables. It takes 30 to 40 calories to maintain a resting muscle. If you start lifting some light weights, which I recommend everybody do a little bit, not this 50 or 100 pound stuff, I'm talking about the light stuff every other day a little bit. Every pound of muscle you gain over time will burn 40 calories, So you're sitting there, it'll burn 40 more calories. You can eat a little bit more. Now, if you use the muscle, obviously you're going to burn a lot more. But that's a very interesting point. So the more muscle you have, the better. Fat that sits on you, a pound of fat burns 3 calories a day. I mean, it's nothing. It's nothing. I mean, versus 40 calorie for protein. So vegetarians don't eat meat. We know that already. Vegans don't eat meat or dairy. We brought that point across. And flexitarians, 70-80% vegetarians. Sort of, I'll eat fish a couple times a week, chicken occasionally, white turkey on occasion. And that's a very balanced diet. You do very well on it. Obviously, if you get the gun pointed into your head and you've had angioplasties and heart attacks and it looks like you may die, well, I would be very strict. I wouldn't be at 80% flexitarian. I'd be a high, dense, nutrient, Joe Furman type diet and stay away from all cheeses, all meats. And you probably do quite well. I've proven it in my patients. You probably do quite well. Don't get pessimistic and think your days are gone. Forget it. Esseltine and Ornish have proven a lot of these cardiac and vascular disease are stoppable, preventable, and reversible. But remember, you don't want to get stuff get started in your kid. So remember just to have your child studied, even if they're perfectly healthy. Remember Furman, I said, nutritarians, nutrient-dense foods. Some lean meat. He allows some lean meat. So he's really a flexitarian, like I am. I know him. I made a friend out of him. He played tennis like I do. And so non-diet as a way of life. Start as your child. We don't want your children dieting, but you got to put the right stuff in the refrigerator. Don't tell your child you don't want him to eat this kind of food anymore. Just don't buy it. He won't barely notice it over time. If you tell him he can't eat this, well, the minute he gets out of the house, he can afford it. He's going to start eating it. And don't say a word. You're the boss. You're the mother. You're in charge. 80% of the time, the mother decides what we eat, and you got to take charge. And if you can't control yourself, it's a problem, not just for you, but for your child. And see, the echinosalts we talked about before, they're the intel chips of your body. They are made of omega-3 and omega-6s. So Americans are eating about 20%, about 20 to 1 omega-6 or omega-3, and that's what causes our diseases. Omega-6 are the inflammation echinocytes. They're the ones that cause cancer. They're the leukotrienes, the prostaglandins, the stuff that you don't want. You need to get sort of 1-to-1, 3 and 6. And these are based on carbon bonds. That's the reason they're 3 and 6 numbers. One has 3 carbon bonds, one has 6. Omega-3, remember, you can get it from fish oil capsules, from flaxseed. Dr. Furman thinks that flaxseed is the best way, that fish oil many times is contaminated with things and may not be that healthy. But to eat, and the fish, you got to know where it came from. You know, if it's farm fish, you don't know what they fed the fish. But it's from the ocean, the deep ocean, and it probably is healthier, although there's some mercury exposure even there. And that's the reason he recommends flaxseed a great deal. And let's talk about stress also. Stress affects your eicosanoids a great deal, and it is a pillar of aging. The steroids from stress many times stimulate our appetite. So if you have a very stressful child, a very stressful family, they all tend to eat a great deal more. Food's a drug. It's a drug like nicotine or alcohol or cocaine. It's no different. It's a drug. You got to really be careful that you're not. The whole family is doing emotional eating. You have to be very careful about that. And it's an addictive process. Some people are addicted to sugar, no doubt about it. But in 21 days, you can get off it. You just got to cut it out of your life. If you want to know how long you're going to live or your child's going to live, look at this website, the Blue Zones. About 33 questions. They'll estimate your life, and then they'll estimate if you want to make these changes, how long you're going to live if you make these changes. A very interesting website to look at. And remember what I said about fat affecting intelligence. Children, adults eat a lot of fatty food. This causes insulin resistance, and insulin resistance is what causes neurotransmitters and neurons to die in the brain. the intelligence of overweight people and children is not as good as in a normal person because of insulin resistance and its effects on the neurotransmitters, the information pathways of your brain. That's clearly been proven. And I was teaching a class on mind-body medicine at IU Purdue recently. I noticed a young lady was pregnant, but she was telling me she had gestational diabetes. And I was speaking a little bit about the diet. And I convinced her to change the way she was eating, put her on a high-density nutrient way of eating, and the diabetes went away. But you could imagine what this blood sugar effect could do on her infant. That infant is much more likely to be highly overweight. Children of diabetic mothers, gestational diabetes, many times weigh 8, 9, 10 pounds, very unhealthy. And they're much more likely to be obese as an adult. They're more likely to have diabetes. They're much more likely to have cancer. So it's very important as a mother, if you have gestational diabetes, quickly go to a high nutrient dense diet and the whole thing will clear up, and you do your child a big favor. You don't want to be killing your child. I know you don't want to do that, but you got to do something about it. You can't just think about it. You got to do something about it. Just like don't drink, don't smoke, don't eat the wrong food. Very important. And the one I'm talking about is my IU Purdue student here. As I already mentioned, breastfeeding the first 2 years of life increases the child's immunity, puts more good fats into the child's brain. The kid's going to be smarter. You breastfeed your kid for 2 years, you're going to be smarter. You're going to be much more better-looking child. Going to be obesity rate goes way down, and you're doing your child a big favor. Not many women have the time or ability to do that. I can understand now in Sweden they have this. I used to play tennis tournaments with the AMA, and I met a lot of people in Sweden. And there, when the mother had a child, they give her paid sick leave for 2 years. For 2 years. I see the point now. You would think that's awfully generous. You can call it socialism, call it what you like, but I'm telling you, and the kids that I saw they brought with them to the tournaments, they were well behaved. They were healthy children. I really see the point. They were ahead of our time. And no caffeine, nicotine, alcohol, drugs, medications, all things that we spoke about a mother should stay away from, pregnant. But you know the best time to start a healthy diet is before you're pregnant. Before you're pregnant. Then you have the proper chemicals in your blood there. And as the infant goes through its growth process in the uterus, much more less likely to have some neurologic abnormality or diabetes or way too little or way too much. So the diet really for the mother, the correct way of eating for the mother should be before pregnancy. But a pregnancy arrives, at least follow it during the pregnancy and after the pregnancy. Only 20% of mothers breastfeed beyond 6 months. All the reasons for them, I don't know all the reasons. A lot of them have to work for one thing. I'm sure some find it also inconvenient. And I don't know all the circumstances, but certainly it's not, in this country like in Sweden, 2 years off for the mother, and they can give a few months to the father. And you might say that's socialism. Well, but I tell you, the kids are a lot healthier, and the pregnancy rate among their teenagers is extremely low. They're extremely low. And at 6 to 9 months, introduce new foods gradually, fresh fruits, apples, pears, peaches, if you're not going to breastfeed them. Also introduce them to vegetables cooked in a pressure cooker or steamed. And also, I would give them a supplement of DHA. That's a precursor to the omega-3, the good echinoids, the ones with brain development. So a supplement of DHA is a good thing to substitute. If you're not going to give them that mother's milk for 2 years, give them a supplement and find out from your doctor how much he'll allow of DHA, good omega-3 supplement for brain development, for cell development. What to feed your child for superior health. Try to avoid the first year fish, red meats, cow's milk, fatty cheeses, butters, oils, and fruit juices with a lot of sugar. Remember you said breastfeeding up to 2 years is best. Human milk is best designed for human babies. Okay? No primate drinks the milk of another primate except humans. Interesting. Immunity is increased with breastfeeding because there are active enzymes in the mother's milk. They're good coenzymes for metabolism, good fats and proteins in mother's milk, much less infections. Mother's milk is high nutrient dense food. Calorie-wise, about 900 calories at 1 year of age, male and female, about 1,000 calories 2 to 3 years, 1,200 to 1,400 4 to 8 years, 9 to 13 years of age, about 1,600 for female, about 1,800 for male, 14 to 18, about 1,800 for females, about 2,200 for males. But if your kid's in a football team, that's a different thing. But I think you ought to watch a little bit what you're feeding them. He's in the football team. I know I used to go to a restaurant over here, and I see that it's closed now, I think, because they had such a buffet table, and everybody knew it, and everybody in town was eating himself to death in there. And I saw a football player come in, and I swear to God, he had a plate of bacon that was as tall as this. You might say, Jesus, he'll use it up in his activities, but I tell you, he's not going to metabolize his cholesterol. That's going to be sitting in his arteries. And that's the reason when you think about it, the professional football players, have you heard? They're dying in their 60s. A lot of them get dementia because some of that's from the hits, but some of that's also from the food they're eating. Diet-related, injury-related. Both things, I think, are involved here. So to make your kid a champion in football and you kill him with a diet, I'm not too sure that's a good idea. Remember the Dallas Cowboys? They're vegetarians. You ain't got to feed fatty stuff to your child. And sedentary or active activity certainly makes a great difference. They make a huge difference. Exercise in a child probably is about 50% of weight loss. As an adult, maybe it's 20, 30. If you got a couch potato, your kid's going to be obese. And he's eating potato chips, you're going to have a problem. So get your child exercising. In adults, it's about 20 to 30%, but still what you eat is the most important thing. And I tell you why. I run weight classes, wellness classes, let's call them. 300 people I get them. One patient lost 100 pounds, and she gave a lecture recently, actually at this library, and she was up there and said, and she works at the Y, and she had 20 people from the Y come down. She says, I worked out there at the Y one day a week, 7 days a week for 3 years. And you know how much weight I lost? 0. Everybody was shocked. I highly recommend exercise. Good for your heart, good for toning. It burns some calories. I'm not trying to downplay exercise. What I'm saying is, and she lost 100 pounds when she followed the high nutrient-dense type diet. And she looks like a movie star now, lost 100 pounds. She's beautiful. And but that's the point. Just exercise will not do this unless you're just up 5 pounds. If you're up 100 pounds, 50 pounds, 30 pounds, this exercise is not going to do it. And it's the mother. 80% of the time, the mother will decide what the family eats. And I'm not punishing the mother here. I mean, I have a pediatrician back in my office. And if I go out the back door of my office, there's a pediatrician's office. So every day I see mothers coming in with their children. My God, they have 3 kids, 2 kids, hanging on the neck, walking ahead, walking behind. They get a job, and they get a big kid comes home, the husband. They're highly stressed. So I understand that. I'm not being derogatory here, but most of the time the mother buys the food. And she's got to know what she's doing. And so I'm trying to stress this point. You will determine what your husband eats, what you eat, and your husband may not be happy with what you bring home, but if you're going to make changes, do it slowly. Just do it slowly. Maybe they won't notice. And no problem with picky eaters. You're the one buying the food. School lunch is a serious problem. Overeating, not starvation. And schools are a real problem. Many serve very unhealthy food. And isn't it a bad idea sometimes during the lunch hour, just walk through the school cafeteria, see what they're doing. If you don't like it, talk to the principal. That's the only way it's going to get changed. And a lot of times they're handing out free government food. Too much corn, too much butter, and they give it to the schools. And they're paying the farmers to grow that darn stuff to kill your children. Pay attention to what's being served there. Same if you go out to eat. Ask the waiter. Most waiters are very accommodating. If there's stuff there, there's nothing there on the menu that you want to eat, ask him, hey, I want some rice, I want some vegetables. I go to dinner a lot with a vegetarian. And he runs the waiters up and down the hall. But they never complain. They get him what he wants. And it's amazing how often I can get olive oil. I put olive oil on baked potato now instead of butter and things of this nature, very high calorie. Every restaurant I go to, today I was at a Bob Evans, they find me olive oil. They'll all find it for you. So I use a tablespoonful, much healthier. I don't use butter anymore. I use olive oil. Interesting. That's a monounsaturated, much healthier thing than use a trans fat like butter, which is a very bad thing. And the inflexible palate syndrome, you may be the mother trying to change everybody, and you got a husband there says, I'm not going to give up beef. That's the inflexible palate syndrome. He can change. You just got to slowly got to do it, and you got to explain to him. You know, your father died at age 50 of a heart attack, honey. You got to change, and we can't live without you. You're dead, but when we get the kids, who's going to take care of us? You got to bend that inflexible palate. I see it a lot. I see it in the office. See patients and they need to lose weight and want me to operate in the back when they're way overweight, and that's causing the problem. And I try to get them, and they get type 2 diabetes, which is 90% of the time totally curable by eating the right food. And he says, I can't give up beef. I can't give up cheese. They can. I did. I don't eat anymore. I ate a hamburger recently accidentally, probably because of the damn thing it was named after me because I gave the cafeteria to a high school for troubled children. And they call it Rudy's Place. They got a hamburger there. It says Rudy's Hamburger. I looked down there, Grey Poupon, my living God. I made them get rid of that pretty quick. And now it's a vegetarian hamburger. But these things will happen. And in fast food restaurants and eating out, talk to the waiter. Many times they're very accommodating. They'll do anything for you. It takes a community. It takes a community to eat properly. What about at age greater than 2? These are recommendations of the American Pediatric Association and the American Heart Association. Balanced dietary calories with physical activity to maintain normal growth. We talked about that. Remember, I said I like exercise. Very important. Pick a sport for your kid that he likes to play. Don't pick something he doesn't like to do. Try to figure out something that he likes to do, no matter what it is. 60 minutes of moderate physical activity or vigorous play daily. Every child should exercise an hour a day. Adults, at least a half hour a day. Between yoga and tennis, I do that easily every week, and I'm a busy neurosurgeon, write books, and I get it done. No excuse. It can be done. But make it fun. For me, it's tennis and yoga. For you, maybe golf and something else. And eat vegetables and fresh food daily. Fill your house full of fresh foods and vegetables. They want a snack, hand them a banana or an apple or strawberries or grapes. Oh my God, I love grapes. My dad ate grapes, I think, the day he was born. And to me, I'm almost addicted to them. Very healthy thing to do. He ate them all his life. He lived a long time. And my mother, too. She lived till age 97. And use vegetable oils and soft margarines, low in saturated fat and trans fatty acids instead of butter. Remember, I said I use olive oil, but this is good advice, too. And I, at home, use some vegetarian type things that look like butter, but they're not butter. They taste like butter. And find certain health food stores you can buy these things at. And they're in every city almost. Fresh markets in many cities now. Eat whole grain breads and cereals rather than refined grain products. You don't want to eat pure sugar cornflakes for breakfast. You got to look at the label. You got to learn to read labels. And then the chapters in these books on reading labels. Reduce the intake of sugar-sweetened beverages and foods. To drink in pops with sugar in them is just out. You can't do it. They have many of them that'll have slightly flavored, hardly any calories, hardly any sugar. Got to find out what those drinks are. And use non-fat skim or low-fat milk or dairy products, or don't use any at all. Eat more fish. Remember, we talked about the stuff that results in your good echinosoids. That's APA and AHA. Those are big scientific names for chemicals that lead to the good echinosoids. And you can get those from fish, broiled or baked. Reduce salt intake. I don't use salt at all. I don't miss it at all. That's strange. I've become an expert in peppers. And I have a friend of mine carries pepper in his own jacket. You don't like it. At a restaurant, he does this. Become an expert in peppers. I don't miss salt at all because it increases your blood pressure, and who needs that? And but you got to watch for it in processed foods. You got to read the labels. Dr. Joel Fuhrman, who's written a lot about diet, Eat to Live by Dr. Joel, excellent work. He's like I said, a friend of mine. He does excellent work. Would say fish and milk are not health foods, and he's got a point. I mean, you don't carry to extremes, but milk really is not a health food. except at age 2 and under. It's mother's milk. That's the healthy food. Why should we drink the milk of another mammal? It doesn't make any sense. No other mammal does it. And who are the biggest animals in the world? We're talking about protein and plants and all this sort of thing. What are the biggest mammals in the world? The elephants and the giraffes. And what do they eat? Vegetables. They don't eat meat. Isn't that interesting? They get the biggest muscles around. I think you get my point now. And fish twice a week is plenty. There's a lot of fat in fish. You eat fish 7 days a week, you're going to get fat. And that's been proven that there's parts of Iceland or very high rate of strokes and heart disease because they're eating so much fatty fish. So too much, it can be too much fish. And the first 2 years, if you eat the wrong diet, you get a lot of children with low birth weight, a lot of malnutrition associated with rapid weight gain. Obese mothers tend to have low birth weight children. And obesity, metabolic syndrome, diabetes, vascular disease, very common in low birth weight children. Large infants, a lot of times, the mother had insulin resistance, and they come out with a big baby and have glucose intolerance. And these, a lot of times, tend to be obese children. So parents must be healthy weight before you get pregnant. But if, once you're pregnant, at least do it then. And obese mothers have obese babies, and it's not healthy and it's not cute. And pregnant women must optimize nutrition and weight gain during pregnancy. Incidentally, there are certain ethnic and racial groups that are much more prone to get obesity. It's because it's in their genetic structure through evolution. It's through evolution. They have what's called a thrifty gene. That's not manifest. It's like the Pima Indians. The Pima Indians in Mexico, they didn't get fat. But you take the same Mexican population, the Pimas, and put them in Arizona, and all of a sudden they're obese, eating the wrong food. It's eating the wrong food is what it is. And it's in their genetic structure. They have that thrifty gene. And these are the ones who made it through evolution because they could store fat. See, years ago, people would maybe catch an animal and stuff themselves, and they'd not eat for a month. That's still in the genetic structure today. I think human milk is uniquely superior before age 2, but after that you don't eat it. It's rich in saturated fat, cholesterol, sodium, rich in immunoglobulins. Children have less infections who eat a diet like that. Lastly here, I'd like to talk a little bit about exercise. I mean, exercise is very important for children. And it's at least 50%, I think, of the eating problem that we're having in America today. Lifting some light weights is a good thing, even for a child. I think walking alone would do it, but running, it would even be better. For adults, I don't recommend running particularly, or jogging, because it's the pounding on the joints can itself cause an increased rate of arthritis. Although fat itself, the most common cause of knee replacements, hip replacements in our society today, frankly, is the overweight patients. Overweight patients. In summary, I think it's very important that you in the home store the proper food. You're the mother. You're in charge. I know there's different family situations. Sometimes the husband is in charge. Don't tell your child he can't eat these, can't eat that. Just don't buy it. When they get hungry, they'll start eating the right food. Set a good example. Start at a very young age, and you've got a problem. Face the problem. Know their BMI. Know their waist measurement. And if your doctor isn't doing them, tell it to do it. And if not, maybe you need to get another doctor. I think if you follow this way to eating, you're going to have a beautiful child, a healthy child. They're going to live a long time and be intelligent while they're doing it. Thanks so much for listening.